All right, so we're back on the inside, and like we said, we're 13 minutes away from the hour of 8 o'clock, and Seth Weil is with us via Zoom, which he usually joins us every Tuesday. Seth, what's up, man? Hemorrhoids today, boy?
Yeah, morning. Yes, hemorrhoids. You know, it's a common issue that a lot of people suffer with, so I decide, you know, do a little segment on it.
All right.
Right? This has to do with the swelling of veins, and you can develop even blood clots in those swellings. All right? But there are two types of hemorrhoids. We have external and internal.
Okay.
So let me just share my screen here.
Now, the external one is the one that is formed under the skin.
Well, you could say both forms under a layer of tissue.
Okay.
But the external one is below something called the dentate.
Mm-hmm.
So the dentate is a section of the anus that separates 2/3 of the anus from 1/3 of the anus. So the lower part, the dentate, is more or less anything below that is classed as external hemorrhoids. So if you get that swelling or development below that, that would be classed as external, and internal would be above. So as you see in the image here, let me get my little marking tool.
Mm-hmm.
Right, so let me use blue. Right, so this area here, so this here would be, let me put this in yeah, this here would be the dentate area here.
Okay.
So any bulging, as you see in here, would be classed as external hemorrhoids. Right, this is what when it gets a little ulcerated, because it can be painless at times, but most people know it as being painful, which is when it gets ulcerated. All right. Of course, most hemorrhoids is formed from, you know, pressure building up, so forcing constipation, even childbirth, lifting heavy objects, and people that might be involved in anal intercourse.
Right.
All right. So these things affect individuals like that. So external hemorrhoids usually goes on its own, right? But it can be very painful. That is, especially anybody telling you about it, very painful, especially the first 24 to 48 hours. But usually after about 48 hours, the body starts to reabsorb.
Okay.
And it would start the healing process, but it can last longer. All right. The internal hemorrhoids, right? This here usually isn't painful unless you reach stage 4. So I would change the image so as to see a little better image with regards to the stages of internal hemorrhoids. So as we see here, the normal rectum in this corner here.
Mm-hmm.
So this is normal, and we are seeing here above so this is the dentate line here, and above that you have the cushioning, or the anal cushions here, which are full of blood vessels.
Right.
And when these start to swell, all right, that's when you start getting stage 1 of internal hemorrhoids.
Okay.
Right. Now when that process continues, you get to stage 2, right? So stage 2, when you're defecating, it can end up on the outside, but when you're finished, it retracts back inside.
Back inside.
Yeah. Stage 3, on the other hand, when you're defecating or having bowel movement, it can end up on the outside, and you have to physically push it back inside. Right? And stage 4 is where it permanently ends up on the outside, and this can also be painful, so it's always on the outside. So of course this might require surgical removal.
Okay.
All right. Now these first 3 stages can heal on their own. Right.
All
but
right.
Stage 4 would require some sort of treatment. Right.
Okay.
So these are issues that affect individual. So let me close the screen here a bit. Now, of course, my whole thing with these stuff is prevention is always better than cure.
Better than cure, obviously.
You want to prevent these things. So hydration plays an important factor, right? Because constipation has a big part to play. Yes, we know about with obesity. Just being obese is a risk factor as well for such. right? Being pregnant is a risk factor, lifting heavy objects and lifting things badly as well. If people learn proper breathing technique when lifting heavy objects, that would help as well so that they wouldn't put all the pressure in one area. This is why it's always good to exhale on exertion when you are lifting heavy objects, right? So that would help to help you not cause a lot of pressure to build up in that region and then put the pressure on these veins and cause the swelling.
Right.
But a lot of people suffering with constipation, and constipation is a common issue that people suffer from, because when you have these hemorrhoids, you would get blood in when you wipe. Usually when you wipe, it'll be a bright reddish color. All right. Usually it's not mixed with stool. All right. So you would see that bright reddish color. So that can be an indication. Of course, not every time you see blood in your stool means that it is just hemorrhoids and it's not something to pay attention to, because that could also mean that you have another more serious issue higher up. Colorectal cancer can be, you can get blood in your stool.
That could be a possibility.
That could be a possibility
okay.
as well. So it's always good to try to prevent these things. So like I mentioned with hydration, because we want to prevent constipation. And over the past couple of days, or for the past couple of weeks, we have been getting some extremely hot weather. Right? So extremely hot weather.
To say the least, yeah.
Yeah.
Boy, you know.
Right?
Somebody sent me a little meme. They put planet Earth, the sun, and Trinidad in the middle.
Well, I see one where they extend it even further. Planet Earth, the sun, and then they have Trinidad, but then they have the house protruding out of Trinidad closer to the sun. Right? So the heat, we have some extreme heat these days. So, of course, with increased heat, you're going to have more perspiration taking place.
Yeah, boy.
Right? So you're going to lose more fluids. But we have to remember, too, when it comes to hydration, as we dealt with last week with hyponatremia, right? Your sodium levels. So your sodium level plays a huge role with regards to hydration. So if you are looking to hydrate and you're just consuming water, keep in mind that salt regulates the water table in the body. So you could drink a lot of water, but if you don't have enough sodium in the body wouldn't know how to regulate the water
right.
and to properly distribute it. All right. So it's not just about increasing your water consumption, but you also have to get in the salt. So I remember when you mentioned in the past where I talk about that I like to drink a lot of club soda and not just regular bottled water, right? Because of the fact that it have added salts in it. All right, so I try whenever I'm consuming any water that is not just empty water, because I don't want to be diluting my sodium levels without adding in some sort of salts or minerals to it, so that the body could be well hydrated, because you don't want to saturate the body with water and dilute your sodium levels, because these can cause things like you can have a lot of water in your system and still end up constipated because of your sodium levels. So simple things like that, right, would help us to prevent ourselves from getting these conditions, which may not be life-threatening, but it can be annoying and even embarrassing. Right? So you want to be able to safeguard yourself from such by taking better care and having a more keener interest in one's health. Also, because of the nature of it, like I said, the embarrassing factor, many people may not want to speak about it. They might see some blood when they wipe, but they would stay quiet on it. They may not want to get it checked out. They may not ask anybody advice on it and so forth.
Because basically because they're embarrassed.
The area.
But like I told somebody the other day, when you have a disease, or when you have an infection, or when you're sick, you don't have time for embarrassment, You understand what I'm saying? Feeling embarrassed it's something could happen to anybody at any time, give or take. Could be different situations, whatever. But feeling embarrassed is, neither here or there.
Yeah, and it kind of can prevent you from getting the help that you needed or the advice that you needed that could correct your issue.
Correct.
Right? So what I tell people with my program that I offer, which is, education, educating people on proper nutrition and health, it helps prevent these issues because you're taking front before front takes you. You know, don't wait until something happened and want to now learn about what you're supposed to eat, how you're supposed to eat, how you're supposed to take care of the body. You know, do that first, because it's always better to prevent an illness, to prevent a disease, than trying to reverse a disease. Right? It's a little more complicated, especially as you're older, because hemorrhoids is something that affects people, you know, over 45, 65 years of age. They affect that age group, age bracket, more than younger people.
Yeah.
All right? And this can, one of the possible issues too is why are they more prone, and it can be due to the weakening of the tissue. Now some say it's age related, but keep in mind, I think it was last year or year before when we dealt with the topic of sarcopenia, which has to do with the body losing muscle mass, and that is not really age related, that is dietary related.
Right.
So if your diet is deficient, your body can be losing lean tissue, and that is one of the areas that can be affected and make you more prone or susceptible to health issues like these.
All right. Well, Seth, thanks a lot for joining us. And of course, people, if you want to find out more, if you want to book an appointment, you call Seth on 761-1952. That is 761-1952. Seth, we're going to chat again next week, man.
All right. Thanks for having me.
All right.
Take care.
Yeah, man. Yeah, hemorrhoids, some people feel embarrassed with, but you don't know how to deal with it.